We have a pretty brief agenda this morning, have a couple of announcements to make. We also have some guests from PMG that are going to share a few updates with all of you. And then we have invited Amanda Sapp back to join us and share a more comprehensive school data report with us. And then happy to take questions as always at the end of the meeting. First announcement, I would like to welcome Connie Johnson. She's a new staff member who's joined our schools team here at the health department. Connie is going to serve as our school nurse liaison. So she will be the main point of contact for school nurses, for the health aides and the health offices to reach out to for support. Eventually, she'll be helping take over and facilitate these meetings, as well as be responding to the school support email. She'll be helping out with a lot of the COVID response. And then as we begin to push out of COVID, we have some really exciting new projects and initiatives that I'm sure we'll be sharing with everybody later. I also just want to remind everyone of some of the mental health resources that the county has put together specifically for K-12 students and staff that have been impacted by the pandemic. We have a website, a web page dedicated to sharing some resources. So that's pima.gov/CV19 and my family. There we've kind of broken the resources into a few different categories. Those for youth that are youth specific for all ages, those for families and caregivers, and then we have a page of resources for school staff as well. On that page, you'll also see there's a link to refer to a behavioral health provider. So this is part of a grant-funded program that we're using to help get students quick access to behavioral health services. The great part about this is that they can bypass the intake, so they don't have to wait to schedule that intake. If they go through this referral through the website, providers can get them in fairly quickly and offer a few brief interventions and sessions with them. It's not going to be around forever. Right now, it looks like this grant is going to end at the end of May. So we're asking that you please share this resources with any families or school staff you think could benefit. When we send out the meeting summary, we'll go ahead and include a small media kit for all of you. And if you wouldn't mind sharing it out in any of the school newsletters or your social media pages, or even print it out and hand it to families you think might be interested, we would appreciate that very much. Also related to mental health resources, our Behavioral Health Coalition is meeting this afternoon for our monthly meeting. For those of you who aren't part of the coalition and are interested in joining us, feel free to reach out to me. Happy to send you the invite for that. We would love to have you there. This afternoon, we're going to be chatting about how to kind of strengthen our coalition, how to structure it for the future so that we can help support schools specifically in responding to the mental health needs that we're seeing in our community. All right, do we have folks from PMG on the line this morning that would like to speak?
Yes, my name is Jody Lafargue. I'm the operations manager over Arizona, and I'm an RN. I'm going to be speaking on behalf of PMG today.
Great, go ahead when you're ready.
Do you have the presentation, or do you want me to share the screen?
I do not have a presentation, so I'll stop sharing and you're welcome to share.
Absolutely. Okay, give me just a moment. Okay, does everybody see that?
Yes, we can.
All right. So again, my name is Jody Lafargue. I am operations manager with Premier Medical Group, and I'm just going to be talking about some services that we offer specific to the schools. A little bit of background: we've been serving Pima County since January of last year, providing COVID-19 relief efforts, including vaccines and testing and really geared towards pediatric solutions. We've also added flu shots for those over the age of 18. And so that's kind of what we've been doing. Here's just a quick snapshot of our Premier Medical team. We've got a wide range from providers all the way down to administrative services, nurses, EMTs. We have some behavioral health, pharmaceutical, and other support staffing services as well. So this is, we mobilize within the community and in all different medical areas. In the past year and a half or so, we've been pretty diverse. We've served for Pima County's health department, and there we also provide vaccines for the kiddos. The pediatric COVID-19 vaccines were also gone to various schools across the county. We've gone to some border ports and other events around town, the airport. We do home visits. We went to the gym show. In addition to the schools, we're also out in the community and other, rural populations, different facilities around town, the tribal communities. So we've left a footprint, around all different areas, including the schools. So if you've worked in Pima County, more than likely you've dealt with us in some form or another, whether it be vaccination or testing. Over the past year, we have provided 21,367 COVID-19 vaccinations at our Pima County schools. So we've definitely been busy. Our impact overall, you can see our statistics there. We've hosted over 249 vaccination events throughout all of southern Arizona. But in addition, as we're COVID's kind of winding down for now, we still have other services that we can offer the schools, especially as we're coming towards summertime. We've got other solutions that we can partner up and start to really plan for, not only summer activities, but then when school's coming back into session. So some of the services that we offer, we participate in the Vaccine for Children program. So that's all of those childhood vaccinations that are required, for attendance in the school. We're able to provide those. We also are able to provide concierge services such as our sports physicals. So for any kind of band camps or sports camps or whatever we've got going on over the summer, anything that requires that sports physical, we're able to provide that right on site. And we could do that also in conjunction with the vaccines, kind of, maybe, for a when they're registering for school and, sports are around the corner, then we could do like a sports physical and vaccine clinic or something, we could tailor it to your specific needs. We also do provide medic tents. So, summers get hot, if you're going to be hosting like a summer camp or sporting event, we do provide medical tents where we can provide that, provide care for, minor cuts and scrapes or burns or heat exhaustion or whatever, may be relevant for that situation. So we're able to serve you in that capacity as well. again, we we'll continue to do that COVID testing. We do the rapid antigen test, and it's a concierge service as well. So those are $20 per test. And if any of these things, if you're interested in any of these services, then please feel free to reach out to Sarani. We've included her information in the comment section, and please feel free to reach out if you want a copy of this presentation, or if you have questions, or you want to book something. Please feel free to reach out to us. Does anybody have any questions?
All right, thank you, Jody, so much. If anyone does think of questions, feel free to pop those in the chat. At this time, I'm going to go ahead and turn it over to Amanda Sapp to present on school COVID data.
Okay, great, thank you. Hold on one second, let me get my screen shared here. It would be helpful to go to the top of the report. Can you see my screen?
Yes, we can.
All right, good, it's still morning. Good morning, everybody. I'm happy to be back with some better news than I was able to report to you the last time that I shared some COVID data in schools with you. So the last time we met, I showed this chart, and I believe we were at 400 per 100,000 cases. So for every 100,000 cases, positive COVID cases in Pima County, at that time of the last presentation, we had 400 persons per 100,000 persons still becoming sick with COVID. And we can see as of this past Saturday, our number is down to 21 persons per 100,000. So we were in a much better position than we were the last time we spoke. And I hope all of you have had a chance to try to desensitize all that stress and get back to actually teaching and conducting school in a good way. So I know everyone's probably thinking about, okay, that's great. Now, it's under control, things are dying down, but what does that mean? Because we keep hearing about BA2 in the media. And the media really likes to, they do their job, right? That a story is a story, and the more people that pay attention is the better. So they tend to talk quite a bit about BA2, and I'm not trying to downplay it, but the way it looks in Pima County is that these are the copies of all the Omicron we had in the county thus far. We did a little digging because BA2 is really on everyone's forethought of what's going to happen with that. Is it going to surge back up? And we checked, and our earliest copy that we saw of BA.2 was in mid-January. And the last time it showed up in our data was almost a month ago, so 3 weeks ago. So that is somewhat encouraging. I don't want to mislead anybody. Anything can happen here with microbes. This could pop off, but as of right now, we can say that we are not looking at a rapid surge of BA2 in the county. As a matter of fact, it looks like it's been pretty quiet for 3 weeks in relation to this particular variant that may or may not cause another surge, according to the media. So I just wanted to kind of let everybody know where we were there. For schools, we have this graph here. Sorry, I'm noticing now that the dates are not easy to see. There's a little overlapping here, but so the trend follows the trend for all positive cases that we saw in the first slide, the green bar chart. That is the full population of Pima County and cases. And here we see the same trend in here happening in school reports. And we see a little bump here on the 45. I would think that is just kind of like negligible to the way that the data is ingested into the database. I don't think that is signaling us that there was an uptick at all. I think there was just maybe some backlogged files that didn't get in there from 15, which would kind of, if this was evened out a little bit, then that would track a little bit better. So I think this was a database ingestation snag, but nothing to really worry about there. So definitely a downward trend, and that makes me happy, and I'm sure it makes everybody on this call very happy. The rest of these slides, as I was listening to the other presenter, I started looking through them, and this is a snapshot of the whole school year. It's pretty much trends the same way that we saw before. This isn't telling us what happened over the last month or whatever according to districts. So I'm not sure how informative this is, to be honest. I should have changed the time frame and stratified this down a little bit to the last month so we could see how each district is doing. And I could commit to coming back on next week's meeting with a little bit more stratified information here. If that is preferred, if you guys would like that, I could do that. But that might not be necessary now that the cases are, rapidly declining at this moment. Again, this is, a snapshot of the full pandemic and the case rates, and also the closures and district enrollment as well, and outbreaks. So here we can see that so far, the 0 to 11 group holds strong as the most implicated by COVID in schools, with a close second being 12 to 19, obviously. So really in the kids, not so much the staff, although there, again, is some data quality issues. We're not exactly sure where these guys are supposed to be binned. So a little bit of an arbitrary assumption on that. And then here we can see middle and high school neck and neck, and elementary, of course, which tracks with this chart here, were the front runners, unfortunately, in struggling with these infections. Here we're not looking strictly at COVID data, so now we're back to what the green graph on the front of the report was showing, and here we're looking at all COVID cases for ages between 5 and 18. And we can see our 18-year-olds had been trending to be, this is by month. So since December, 18-year-olds were popping off to be the highest. All of these numbers are obviously quite low now, so that is good. And then this is really encouraging to see that this is the first time in 2022 where we are below the 2021 values. So January and February 2022 is pushed way above what we had ever seen so far in the pandemic. And now here in March, we can see that we've dropped below the 2020 level, the 2021 level count for March. So hoping that just keeps trending in that direction, and soon you won't even be able to see the little blue line here. And then these last few slides just show the different, frequency of brands that are being distributed. And I guess we didn't have the data yet for April since we're only 7 days in, so that's why there's a gap here. But some good trends here, where we saw, a nice big surge of vaccine uptake in the 5 to 11s for the Pfizer when that was released. But of course, as cases drop, so do vaccine rates. So I would anticipate that this would continue to go down until people get scared again, and then start thinking about perhaps getting a booster, getting their first vaccine shot for COVID. And again, this is just, how many events were in the county by day for vaccine clinics. I'm sorry, this is actually events in schools, school events in the county. So that's really all I have. I am open to having you guys put in a request if there's something that popped in your head as I was going through what I have here today, that you would like to see. Perhaps feel free to put it in the chat. Matt can follow up with me later. And I can definitely come back next week and provide maybe a little bit less of a whole overview, which I think is more informative. We can break it down, some of these, I guess, by month, or even the past few weeks by district, and just try to kind of give you a better idea of what's going on in your districts in a shorter time span. So if there are not any questions, that's all I had to share today.
Amanda, thank you so much. This is very helpful. Are there any questions specific to the data that Amanda presented that anyone would like to ask while she's here?
Yeah, Matthew, this is Kathy Stanley. I put something in the chat. I just have a question. I know that our numbers are dramatically dropping, although we're still seeing some positive students in the schools. But since we know so many people are using the home tests, and those are not necessarily reported to you all, I was wondering kind of how many PCR tests are you actually obtaining compared to what we were seeing earlier? And since we know genomic testing is only done on about 8% of PCR tests done, do we really have a good picture of what actually is out there circulating? Because I'm just wondering if we're getting enough tests done to really capture what we're seeing.
Before I respond to that, Amanda, did you have anything to speak to that question?
Yes.
Kathy?
Hi, Kathy. Thank you for your question. You make very good points, right? So people who do pop up on a home test, there's no way to know whether or not they report it or not. We're trying to incentivize them to do so. I would say, though, that the 8% might be a little underestimated. I can get back to you with a hard number on how many PCR tests are currently being done, and also how many PCR tests are going to that WGS process.
Yeah, I'd just be curious. First off, I have no idea. I know that testing, I'm sure it's ramped down somewhat because people aren't as panicky. But also I know that we're getting ready possibly that it may end up costing money. I think people are concerned already that their insurance, they have to bill their insurance, which will be another barrier to getting testing done. I was just curious if we knew kind of where we were with how many people are actually accessing PCR tests and whether that's giving us a good picture or whether people aren't getting tested and we're flying blind.
That is a great question and not something I have off the top of my head, but I definitely can answer this for you. So
okay, that's all. I don't mean to be like a negative Nelly, but I'm kind of worried.
No problem. Those are valid questions, Kathy. No problem. I can follow up with you in email. Is that okay?
That would be perfect. Thanks.
Okay.
And I think Matthew's got my email. So
okay, great.
Unfortunately, everybody has my email, but thank you very much.
No problem. Thank you.
Excuse me, I've got oh, sorry. I was just going to add real fast that Erica Spence isn't on the call today, but Amanda and I can also follow up with her as well to see if she has any additional insight. And also, there's another testing related question from Megan in the chat regarding pooled testing. And that is something also that we're connecting with ADHS on, since they kind of manage the pooled testing program to figure out what they're advising at this point in time. So Megan, we'll get back to you on that one as well. Sorry,
if I could,
go ahead.
Oh, no worries. My question is regarding quarantine guidance, and are you hearing anything maybe coming from the CDC where we are getting any closer to just if you're sick, stay home, and if you're well, come to school, and just sort of getting away from the prescribed quarantine time?
That is also a great question. I am not on the side of EPI that deals with that kind of policy changes in the county. I, though, can answer your question. I know exactly who I can get this answer from. And so I have not heard anything from the CDC. I haven't heard anything internally about any of that being changed, but that doesn't mean that something hasn't been addressed. So I will look deeper into that for you.
Okay, thank you. I think we're just trying to think about next school year and the level of parameters that we're going to need to continue versus hopefully moving away from those things.
I would say to that if this trend continues and we hold strong, I would think that quarantine guidance will be updated for sure. If we start to see in the beginning of the next school year that we start to have the uptick, which is what happened in 2021, then with Delta or even wild COVID, then I'm it's ebb and flow. When the cases go up, guidance goes, guidance changes. So hopefully, hopefully the trend
Okay.
continues and they will change that guidance. Like, I think we're all eager to get there for sure.
Okay, thank you.
I see a question here about variants eliciting a positive test result on rapid nasal swab testing. That is a hard question to answer because the only time a variant is identified with an identity is when it goes from PCR to WGS. So I would have to know of the WGS tests, how many of them started as rapid nasal swab tests. That is not something I have offhand, although I may be able to figure that out.
Amanda, I think what they were asking is, do the rapid tests that we do in schools or that are done at home, do they capture, or do they still identify even though we have different variants circulating? Yeah. I think is what they were asking. And I think the answer is, so far they do. We haven't had a variant yet that they don't capture. But I think that's what the questioner was trying to determine.
Yes, so the nasal swab will, if there's a presence of COVID, the nasal swab will capture the DNA of that COVID. If that particular nasal swab is then processed for WGS, then that's when the identity of the variant will be determined. So yes, there are variants being able to be deciphered off of nasal swabs.
And it does look like Erica Spence is able to join the call today. So if you haven't seen some of her answers in the chat regarding some of the testing questions, go ahead and take a look. She is responding. And our time is up. If anyone else has questions, feel free to pop them in the chat. We will respond to them in the follow-up email. And Amanda and Eric and I will also get together and work on those follow-ups for you for those questions that went unanswered. Wish everyone a good rest of the week. Thanks for joining us today. Be safe, be well. Take care.
Did we go over the data?
Hi there. We went over quite a comprehensive data report from Amanda. We can see if Amanda can shoot us a copy that we can send out to everybody.
Oh, not that one. The one that we do like the weekly that usually has like the number of cases for the week, like the 7-day total.
Oh, hi, Megan. No, I didn't go over those specific numbers. Okay. We're still in the green in Pima County. No change there.
Okay.
So, yep.
Perfect. Thank you.
Mm-hmm.